I'm Dr. Vidyadhar Bangal. I am Professor and Head, Department of Obstetrics and Gynaecology at Pravara Institute of Medical Sciences, Loni, which is situated in Ahmednagar, Maharashtra. I completed my medical schooling at Mahatma Gandhi Institute of Medical Sciences at Wardha 35 years back. And since then I am in teaching profession for last 35 years. Seeds of my medical professional career were sown at this premier institute, which is known for its pioneering work in community-oriented medical teaching and quality research. I was born and brought up in rural area. I was educated in rural area. My medical schooling was also in rural area, and I am happy that I am serving the rural area since last 35 years. During my childhood, my father intentionally exposed me to the sufferings of the rural and tribal community and the hardship these people have, especially when they are sick. He used to show me their sufferings. It was very intentional, and I think when they used to approach him, he used to call me in the clinic, which was a general practitioner, and just used to tell me that observe these people. So this is how I was exposed to those poor people from childhood. My journey into maternal space started during my residency at Mahatma Gandhi Institute of Medical Sciences, and there I used to see many high-risk patients, high-risk pregnancies, obstetrical emergencies. A lot of exposure I received there, and I could see all those poor women from rural area were facing all those complications of pregnancy. I still remember a case during my residency when a woman with ruptured uterus had come in the evening hours and she was brought dead. The baby was floating in her abdomen, and all those experiences led me to choose this particular profession which I am there in since last 35 years. Of course, the influence of my dedicated teacher, she was very passionate about maternal health, Dr. Shakuntala Chhabra, who is still working in tribal area of Maharashtra. She used to tell me and whole team that do your best and rest leave to Almighty. And since then, we are practicing the same, and I consider her as my role model and a mentor. She is still working hard in her old area of interest, and I am happy that I am able to continue her vision and mission in another area, but rural area of Maharashtra. Last 35 years I am in teaching and providing maternal health. As a teacher, I have a dual responsibility. I am teaching the undergraduate students, postgraduate students, the students who are going to become obstetricians in the coming years. So I feel that it's my responsibility to tell them, teach them whatever is best and which is evidence-based. This particular institute where I am working since inception, maternal and child health have remained as priority areas, focus areas for this organization. The environmental culture and the institutional culture is such that all the efforts are being made to provide best quality of care to the mothers in the area, and the institute also maybe I will say enjoying the trust of the community which is being served. That is reflected through large number of deliveries being conducted every year. Nowadays almost 11,000 deliveries are conducted at Pravara Institute of Medical Sciences. Last 4 years I incorporated many projects and principles of midwifery into the department, and I revised a lot of protocols and brought a lot of changes in the working pattern of the labor room. Respectful maternity care has become a new norm. A labor companion has also become a new norm, which has helped us in improving the whatever satisfaction women have at the end of the delivery. This has also reduced the unnecessary interventions being carried out in obstetrics these days, like artificial rupture of membranes, unnecessary inductions, episiotomies, and also C-section rate. We are also giving women a choice of birthing positions. They are being taught during antenatal period, and also we have introduced all possible measures for non-pharmacological pain relief during labor. We also get feedback from the mothers so that it helps us if we hear something good about the quality of care being received by our clientele. We also feel good, there is a moral boost, but at the same time it also helps if there are any deficiencies in care, that helps us in improving the quality of care. Few quality improvement projects are also being implemented, that is, which are evidence based, like active management of third stage of labor, delayed cord clamping, labor companion and its benefits. So all those things are being incorporated. I am also informally started the midwifery-led care unit at my place, and the team is also getting oriented to this newer concept of midwifery. I have a firm belief that we must unlearn certain things. Even as an obstetrician, there are certain things which we need to unlearn, learn and relearn. Whatever is good, whatever is evidence-based, whatever is shown to be beneficial to the outcome of the pregnancy, that has to be followed, and that's how I have implemented many changes in my labor room. I am of the opinion that Government of India must create a cadre, separate cadre of qualified skilled nurses, which we call it as midwives, and they should be made available. The number of the midwives should be ample and should be enough considering the size of our country and need of our country. There should not be any sort of a tussle between obstetrician and the midwives. They must work hand in hand. They must work with harmony. Low risk pregnancies can very well be managed by midwives, and obstetricians should spend their maximum time in management of high risk pregnancies, obstetrical emergencies, operative deliveries. That should be that is what I foresee in the next couple of years. Present maternal health care being provided by the obstetricians, I feel that it is too much medicalized. If we hand over part of it to midwives, they will be able to provide more humanized care that will not only improve the outcome, that will not only increase the natural birthing percentage, but also it will improve the women's satisfaction or the birthing experience of the women. Thank you very much.